In this video, we'll talk about socket grafts, right? When we take out a tooth and we put in a bone graft, how to keep it so that it heals well, the graft isn't moving all over the place, and so that the bone is nice and strong so that we can place an implant later. We'll go over the key points that when I learned them, I was like, oh gosh, I wish I knew this before, and helped significantly both in how I do it, making it easier to actually do it chair side, and made the end result better healing wise and final bone wise. And so the process I'll walk you through is what I think is the easiest and fastest technique. So there's other ones out there that may be a little more beneficial in certain scenarios, but if you're just starting out with socket grafts, or if you aren't great at extractions yet, or not fast, I should say, and so you're trying to get done really quickly, this is the easiest, fastest, most foolproof way to get it done. So the first tip is always to make sure that the tissue is fully removed from the socket. So if there's an infection in there, obviously you have a bunch of the granulation tissue, right? The stuff that looks like boogers in there. We need to scrape all of that out. But even if the tooth doesn't have that and it's a fairly clean extraction, there's usually still remnants of the PDL in the socket. And so one of the main reasons that we place a membrane over bone grafts is to keep the tissue from growing faster, right? Tissue grows faster than bone, so theoretically, some people say you don't need to place bone graft or membranes, but theoretically, if you place the bone graft, the tissue can grow underneath the bone graft very quickly, and then the bone graft is kind of just sitting there in between tissue and won't actually integrate and become bone. So that's why the membrane is placed underneath the sulcus. It's to slow down the growth of the gums. And so if we leave PDL or ligaments inside, any soft tissue inside the socket, that soft tissue will proliferate and grow, and wherever that grows against the bone, your bone won't be able to connect there. So sometimes people will have bone grafts placed and they come back 5 months later and they can still see the outline of the tooth. They see bone in the x-ray, they see their bone graft in the x-ray, but they can still see the outline of the tooth. And 9 times out of 10, that's because we weren't able to fully remove the tissue. So you want to do this with either a curette, if you're strapped for time or just lazy, a big round diamond burr on your implant drill is a really fast way of getting all the tissue out of there without cutting any bone. But whatever you do, you want all of that out so that it's bone on bone. The next thing that you want to check is that there's blood inside the socket, right? If there's no blood in there, no healing will happen. So if there's not blood in there, this will happen maybe 1 out of 100 extractions you do. You'll want to actually drill holes into the bone, into the socket, so that blood starts to come in. Once there's blood in there, you take your bone particulate and pack it in there, make sure it's nice and condensed in there, not too hard, but you want to make sure it's in there pretty well so it's not moving around. And then you put your membrane on top. And so the biggest tip that I have that I wish I knew when I was starting is the membrane. If you want the easiest, most foolproof way, use those little titanium membranes. They're white, but they're made with a titanium mesh, and they're non-resorbable, so you'll have to take them out when you take out the stitches, but it's worth it. What you do is you cut it into a circle so that it fits, or an oval, or square with rounded corners, so that it fits almost perfectly inside the hole. And what you do is you just tuck it just gently under the sulcus so that your sulcus goes over and your membrane is underneath. And then all you need to do is suture the 2 sides over top. It'll pull it in a little bit and it'll hold it down very well. What this does is it almost gives it primary closure from a healing perspective, because you're fully encompassing it. You won't have the blood supply from the top like you would if you had true primary closure and the gums were actually over top. But what you have is your bone graft fully held in there. Your gums are going to be tightly pulled over top. And because it's such a thick, durable membrane, you can really apply a decent amount of force to it with your sutures. So it'll keep the bone graft more stable and it'll make it heal much, much better. And so when they come back in 2 weeks, 3 weeks for their suture removal, you just take your sutures out and you just pull it out and you'll still see the bone graft underneath, and that's okay. You don't need to recover it up or anything. You just leave it like that, leave the bone exposed, and it'll heal much, much more easily. You can use those more delicate collagen membranes, but they're much more difficult to handle. And it takes better suturing. So if you can get that primary closure, you can get enough stability with your suturing technique, then those are totally fine. But this is the most foolproof way that I wish I knew when I was younger.